April, but not yet in effect, says that victims like her won't have a choice to an abortion. They will be forced to carry out the pregnancy and deliver their raped child. This law prohibits women from obtaining an abortion after a fetal heartbeat is detected. This is only 5 or 6 weeks into a pregnancy, and is before most women even know that they are pregnant. This law provides no exceptions for rape or incest. Healthcare is the key to a woman's well-being and economic stability. We've got to make sure that the new healthcare laws keep working for women.
After doing extensive research on this topic, it is clear that while abortion is a women's health issue, it is also a hot topic. In addition, the legality of abortion will affect all of us as voting citizens, as it is projected to be the center of the 2020 election. Women should have the fundamental right to decide what to do with their bodies. To uphold this right, United States healthcare policy should maintain funding for reproductive rights and keeping abortion legal. Today, we are going to take you through 4 aspects of reproductive rights and the effects of each: Planned Parenthood, U.S. healthcare policy on reproductive rights, the history of abortion, and the different laws depending on state. So in today's climate, and thanks to Donald Trump's admission, there's a lot of talk recently about defunding a huge healthcare organization. I'm sure you guys are familiar with it, Planned Parenthood. Planned Parenthood should remain funded because it provides people with essential testings, screenings, it educates the youth, it provides contraceptives, and it gives women more choices when it comes to unwanted or unintended pregnancies. Planned Parenthood was started in 1916 by Margaret Sanger, who was an activist and a feminist. It was founded on the idea that women should have the information they need to live the most healthy, safe, and fulfilling lives. It was opened in 1916, and 9 days after its opening, it was shut down by police, and the 4 women who started it were arrested. Clinics reopened, and in 1930, a clinic was opened. Oh my gosh, I totally forgot about this. Guys, I'm so sorry. There we go. A clinic was opened in Harlem after Black women and men were being denied their health care rights. At this time, reproductive health care was considered to be extremely controversial, and especially birth control was considered legally obscene. In 1936, birth control was no longer classified legally as being obscene, and New York, Connecticut, and Vermont became the first states to legalize and distribute birth control. Then in 1952, the International Planned Parenthood Federation, IPPF, was established. It's a global non-governmental organization with the broad aims of promoting sexual and reproductive health and advocating the right of individuals to make their own choices in family planning. This is a family planning class in Kenya that was offered through IPPF in the 1950s. Not only did Planned Parenthood offer services that were essential to changing lives and saving lives, but it was also the start of a new era for women in healthcare. In 1961, birth control was legalized for married couples. This gave women the opportunity to choose whether they wanted to carry out a pregnancy or not, and when they wanted to start their family planning. In 1967, the Clergy Consultation on Abortion launches, and Reverend Howard R. Moody, this is him, minister of the Judson Memorial Church, along with 19 other Protestant ministers and 2 rabbis, established a national underground network of 1,400 clergymen working to help women seeking abortion. 3 years later, when the law was legalizing abortion in New York, he worked to open clinics in New York helping women who were seeking safe legal abortions. In 1972, birth control becomes legal to all women, and this gave women who were vulnerable, under-resourced, or underprivileged, or simply just not wanting to carry out a pregnancy, the choice on whether or not they wanted to do so. Then in 1973, Roe v. Wade happened, which legalized abortion nationally. The U.S. Supreme Court rules that the constitutional right of privacy for a woman to choose whether to have an abortion or not. And today, abortion is one of the safest medical procedures, and nearly 1 in 3 women will have an abortion in their lifetime. However, healthcare took a step back in 1976 when the Hyde Amendment was passed. This law prohibits the use of federal funds to pay for abortion except for extreme circumstances like rape, incest, or life-endangering pregnancy. For far too long, this country has penalized low-income women seeking abortion, forcing those who have the least to pay the most in order to access safe legal care. A PPFA study shows that when policymakers place severe restrictions on Medicaid coverage for abortion, it forces 1 in 4 women to carry out an unwanted pregnancy. In 1977, Rosie Jimenez became the first woman to die of an unsafe abortion after the Hyde Amendment made it so her abortion could not be afforded. Although Planned Parenthood did a lot to start this new era for women and start this new era of healthcare for everyone, there also was a lot of violence that came with their victories. In 1985, violent attacks on Planned Parenthood began to escalate. There was attempted bombings, arson, and violence, all for simply providing healthcare to women and men that were in need. In 2015, there was a mass shooting in Colorado, which is like the picture that's on the left, at a Planned Parenthood that resulted in 3 fatalities. In 2004, however, the first Women's March occurred, and that was a new start for women in healthcare, and it showed like the united force that came behind Planned Parenthood. According to Diane Silver's article, Planned Parenthood is healthcare and healthcare must defend it, this idea of defunding Planned Parenthood started early in the 21st century when extremist groups would create these doctored and falsified videos demonstrating how Planned Parenthood was unlawful, and then politicians would use these videos as propaganda to enact policies to defund Planned Parenthood. Defunding Planned Parenthood pretty much just means it will block patients who rely on public health care programs like Medicaid and Title IX from getting their care at Planned Parenthood health centers. According to the Family Resource Council at Planned Parenthood, 60% of Planned Parenthood patients use Medicaid or Title IX to cover their health care needs at Planned Parenthood. Defunding Planned Parenthood is a part of a larger agenda to shut down Planned Parenthood health centers and make it impossible to access safe and legal health care. According to the Women's Encyclopedia of Health, defunding Planned Parenthood health centers would result in the loss of reproductive health and primary health care services that could not be immediately replaced by community health clinics or other providers in under-resourced communities. Their losses constitute a dangerous threat to the public health of communities across the United States, according to Regan McDonald Mosley, who's the Chief Medical Officer at PPFA. To summarize the importance that Planned Parenthood plays in healthcare for women and for men, it's important because it's an organization that was started by women to help liberate and educate women on the options they have in their reproductive health and in their family planning. Planned Parenthood has faced much adversity, controversy, and violence, and it has been facing these attacks since its opening in 1916, and it will always continue to fight back. The controversy surrounding Planned Parenthood is mainly focused on abortion, which is only 3% of the services that are actually provided at Planned Parenthood, so it seems a little bit unfair for there to be so much controversy and so much talk of defunding it when it provides so many larger services to those that are under-resourced, underprivileged, and lower economic status. Planned Parenthood remains funded because it does provide safe and legal health care services to people of all races, genders, classes, and backgrounds.
Though Planned Parenthood does not only offer abortion services, abortions have been the topic of debate recently. They have been reported for a very long time, and it has only been recently that restrictions have been imposed. The word abortion refers to any premature expulsion of a fetus and may occur through medical procedures. The earliest record we have of abortions is more than 4,000 years old, and it is only recently that it has begun to be restricted in the late 1800s. According to Abortion is as Old as Pregnancy by Katie Klabusich, the Comstock laws outlawed abortion in 1873, but this did not reduce the number of abortions performed. This only increased the number of safe abortions. And by the 1920s, 15,000 women died annually because of unsafe abortions. This number only increased to 1.2 million in the 1950s. As you can see, this pro-life stance and what comes along with it does not always have the favorable results that one may think. It was not until the 1970s that abortion began to be less restrictive. The abortion history timeline by Catholic News Agency states that while some states like Mississippi and Alabama only allowed abortion in cases rape and incest or to save a mother's life, there were other states like New York that in 1971 allowed abortion up until the 24th week of pregnancy. And in 1971, there was also the first U.S. Supreme Court case, and that was the United States versus Buich case, and this court case allowed a District of Columbia law and permitted abortion to preserve a woman's life or health, and by health they meant both physical and emotional health, so that there was more room for you to get an abortion. And by 1972, 13 other states had developed similar laws. The real game changer for abortion laws came in 1973. It started off when a woman named Norma McCorvey, better known as Jane Roe, became pregnant after being raped. In her home state of Texas, she was not allowed to get an abortion, so she filed a lawsuit claiming that her constitutional human right was violated, and this is her. She actually says that Roe versus Wade, that changed abortion laws nationwide, was her biggest regret later on and took on a pro-life stance. But the result of Roe versus Wade was a trimester pregnancy scheme, and in the first trimester, abortion could not be restricted for many reasons. You could basically get an abortion for any reason without restrictions from your states. And then in the second trimester, some restrictions could be added by states, but only to preserve a mother's health. And in the third trimester, abortions could be forbidden with exceptions made for saving a mother's life. And in the 1980s to early 1990s, abortion laws became a little bit messy as Republicans came into presidency and into the U.S. Supreme Court. But all this was undone by 1992. In 1993, when President Clinton came into power, he undid a lot of pro-life policies, such as the Mexico Policy Fund that funded international organizations that worked to reverse abortion laws, and he ordered military hospitals to perform abortions. He also ordered Medicaid centers to provide payments for abortions, and not just for incest or rape. The key facts on abortion by Amnesty International states that nowadays, 1 in 4 pregnancies end in abortion worldwide. This number is 34 abortions per 1,000 pregnancies in countries that allow abortions broadly, and 37 per 1,000 pregnancies in countries that do not allow abortions. So, as you can see, this demonstrates just how much we need safe access to abortion laws. The history of abortion by National Abortion Federation says that restriction access to abortions is unconstitutional. States forcing someone to carry on an unwanted pregnancy or forcing them to seek out an unsafe abortion is a violation of their human rights, including the rights to privacy and bodily autonomy. If you do not know, bodily autonomy is the right to have control over your own body without external influence or coercion. The right to privacy and protects personal decisions from governmental interference. So, as you can see, abortions have been a topic of debate for many years, but women should have access to receive safe abortions because, as history has shown, restricting abortions is nothing to reduce the number of abortions actually performed. This only increases the number of people forced to seek out unsafe abortions. Women should have the right to make decisions regarding their own bodies and should have better access to reproductive health.